My friends, this pandemic will change our nursing profession forever. And while the spotlight is on our healthcare system, our disease-focused model, we have a once-in-a-generation opportunity to change everything for the better. In fact, there are 3 simple changes you can make in your practice right here, right now, that will prevent our failing reactionary model from continuing to be our norm. And I promise that these 3 changes will fundamentally alter the entire way that you work and practice. So today I'm talking about exactly what all of us nurses can do to ensure that we never go back to the failing system that we've been propping up for decades. In case you don't know me, my name's Peter Giza. I'm a registered nurse, board-certified nurse coach, and co-founder of the Nurse Coach Collective. Welcome. I'm so happy to have you here with me today. Before we dive into today's conversation, I want you to know that my love and support goes out to our frontline workers. I've been holding you in my meditations every single day, praying for your safety and for the health of our population. In fact, I think one of the more difficult things to do is to balance speaking about the enormous suffering that's happening presently, while also continuing to be hopeful about the future. But here we go. Over the past few months, we've been experiencing an acute exacerbation of a chronically ill healthcare system. COVID-19 has shown a spotlight on the innumerable shortcomings inherent in our disease-focused healthcare model. Shortcomings that have existed for too long and that cannot continue to exist anymore. At the best of times, nurses are constantly asked to do the impossible. Our time with patients has been hijacked by computer documentation, medication administration, and care coordination. Those 3 things consume nearly 75% of all of our time spent at work. And now I'm not negating the hard work that you put in every single day. Nurses save lives, period. Yet 90% of all healthcare resources, money, time, energy, 90% of that is wasted on managing chronic diseases. Wasted. And I say wasted not because the sick don't deserve to be cared for and healed, and not because you don't put your heart and your soul into your work, but wasted because we know there's a better way to do it. We know that 4 out of 5 cases of chronic disease are preventable and reversible through lifestyle coaching. Like, imagine how different your life would be if we allocated just half of those enormous resources of more than $1.5 trillion and millions of healthcare professionals. Imagine what could be different if we allocated those resources to focus on getting to the root of disease, instead of feeling like we're drowning inside of a sea of disease. What if 80% of cases we see in the hospital simply went away because we were focused on helping people in a way that was congruent with science, with best practice, and what we know in our hearts to be right? Like, how much could be different for us? And to be clear, this isn't wishful thinking. It's a matter of sustainability and creating a new reality for ourselves to live in. We nurses cannot continue to prop up a wasteful, flawed medical model, a model that's based on the sunk cost fallacy, which describes our tendency to throw good resources on a burning fire. The sunk cost fallacy states that just because we've already spent an enormous amount of resources on something doesn't mean we should continue shoveling more resources at it just to maintain a failing status quo. For example, the first time your car breaks, you fix it. But the 20th time it breaks in a year, you are probably better off selling it and buying a new one. You see, more than $3 trillion annually goes towards managing chronic diseases, and managing them ineffectively at that. And let me put that in perspective for you. That's more than the entire stimulus package that was passed to prop up the American economy in the wake of the coronavirus. And as a nurse, you know this better than anyone. Managing these chronic diseases turns every shift into Groundhog Day. We give meds, we chart incessantly, and we break our backs just to wake up the next day to a new shift with the same problem. And our altruism has been pushed to the max. We give and give while the hospitals take and take. You want to do a great job, but they give you yet another box to check, another policy to implement, another patient under your care. And you're expected to do all of that within the exact same length of shift as before, or else you risk disciplinary action for staying late to document. So it's no wonder that we are experiencing moral injury at an unprecedented scale in the medical profession. We know, both scientifically and in our hearts, that we could be practicing in a way that's congruent with the entire reason we became healthcare pros in the first place, to help people to truly heal and to get better. So once the COVID-19 pandemic comes under our control, which it will because we have so many smart and talented medical professionals working their butts off and risking their lives to ensure that's going to happen, let's let their sacrifice not be in vain. Earlier, I told you there were 3 changes we need to make as a profession on an individual and a systemic level. 3 changes that will prevent this failed system from continuing to abuse our altruism and decimate the well-being of nurses and our patients. And these 3 changes are to slow down, to remember how powerful you are, and to take action. So first, slow down. Many of you have been furloughed, and I invite you to use this time to reflect on how you want to serve as a nurse. There are hundreds of thousands of jobs out there, and the wellness paradigm is just beginning to take root. For those of you who have been in the midst of a war zone, take a much-needed break after this is all over. Decompress, talk about your experiences openly and with candor, and take the time to heal. Let's all take a collective deep breath and reassess exactly how we want to move forward, because the disease model of healthcare, it needs to go. And the second thing is to remember how powerful you are. As a nurse, as nurses, we are the lungs that breathe life into the health of this nation. Never forget that. There are so many jobs out there for us, and we deserve to work in an environment that provides respect, safety, and fulfillment. And finally, the third thing is to take action. Be fiercely loyal to yourself and your values. Speak up at all levels to create change. Connect with colleagues who get it, and wherever you are right now, take one tiny step towards creating the practice you deserve and the health your community needs. Because if we can all make a choice right here, right now, to commit to these 3 changes, to slow down, to remember how powerful we are, and to take action, then we don't need to wait for the system to transform. The wellness model begins right now. So I would love to know, what is your tiny step? In 1 to 2 sentences, what action are you willing to take to make the wellness model our new status quo? Thanks so much for watching, and we'll see you soon.